I have kind of called this issue the cancer rehabilitation gap. So you have physicians, med-oncs, rad-oncs, surgeons, pathologists, radiologists, geneticists that don't know enough about rehabilitation because you don't get it taught in school or very little in school. And again, it's not a profession that typically gets exposed to physical therapy like an orthopedic docs. They know what we do. Physiatrists know what we do. Neurologists know what we do. Cancer surgeons and medical oncologists, they typically don't know what we do. Okay. And then on the other side, okay, we have rehabilitation therapists that come out of school with maybe an hour or two, either on cancer care or on cancer rehab. So we have two highly trained professionals that don't know what the other does. Okay. So cancer practitioners don't know enough about rehab, and rehab practitioners don't know enough about cancer. So thus the cancer rehabilitation gap. And unfortunately, our patients are falling into that chasm. You and I have talked about in the past in our first episode about minimizing preventable loss. Yep. Okay? There's so much that goes on that doesn't have to happen. Cancer rehabilitation is low risk, low cost, reimbursed, evidence-based care that patients, our cancellation no-show rate is typically very low. And I don't hear it very often anymore, but every once in a while I'll hear one of my colleagues say that, no, the doctor says, oh, they don't want to go to rehab. And I'm like, well, they don't want to go to chemotherapy, and they certainly don't want to go to radiation, but patients do because they know their life depends on it. So if a physician tells a patient, you need to go to rehabilitation, they're going to do it. Yep. Okay? And when they get there, they realize, wow, this is really a good thing. It's no offense to you guys on your side, but it's typically their favorite part of cancer care because it makes them feel better. They get quick results. They feel more empowered. They feel stronger. They feel less crappy. And they're like, wow, okay, I think they feel hopeful that they can get through this. And they know that eventually we're going to make sure that they are as okay as they possibly can during treatment and then get back to normal as soon as they can afterwards.
One of the things that I have always loved about your presentations is the emphasis on preventable loss. Because people are just going to be sitting around and not moving and whatever. They're losing muscle mass, they're losing range of motion, they're losing mental well-being. So not only do we have preventable loss on one end of the spectrum, but we've got improved outcomes on the other end of the spectrum. So all of this, in my view, is an emerging standard of care and is critically important. But please, your emphasis on preventable loss, I think, is really important.
I think I call it some of the three most damaging words potentially in cancer care is take it easy. Docs just tell and nurses just say, take it easy. Their patients are overwhelmed, they're stressed, they're distraught. But you know what? Sitting on the couch doesn't fix anything. So from our point, when I meet with a patient, then I'll say, you know what? You can be miserable or less miserable often. I highly recommend less miserable. We can't make this perfect. We can't, eliminate everything, but by keeping you active and strong and healthy, we can get you through this better, faster, with less loss. So you don't have to rebound as far. One of my favorite lines is, we do not have to rehabilitate what the patient doesn't lose. So waiting until patients crash, or waiting until they have functional deficits, or waiting until they can't do something is way too late. So we really encourage people to get into our care as quickly as possible. And as I described this, Jay, it really is quite simple, because we in healthcare, we already have the tool of cancer rehabilitation to improve patient and program outcomes. So again, we're improving things for the patient. We're also going to talk about how we improve things for the cancer program or the health system. So in the face of increasing cancer cases, physician shortages, changes to reimbursements, it's imperative that we marry these two talented professional groups together. So rehabilitation is and should be an integral component of a cancer care program, because it's going to improve both patient care and patient care outcomes. And that's a good thing for everyone. This is going to be sweat inducing for most cancer execs because these are things that are happening. We're seeing a massive increase in volume of cancer patients because of, again, our increasing population age and size. But there's practitioner shortages, reimbursements are shrinking, costs are going through the roof, and we are expecting value-based care to impact oncology in the next couple of years. And then it's really interesting is now that I consult across the country helping cancer centers build cancer rehab programs. And one of the things that really comes up on their list of things is we want to get better at what we do, but we want to be better than the guy 10 miles down the street. And how can we make, everybody's got the same imaging tools now, everybody's got access to the same stuff. What can we do to make ourselves stand out to the public when it comes to our cancer center? And they're like, hey, we have this really great rehab program. So when you're going to have surgery, you're going to have chemotherapy, but you're going to be working with a PT. Patients are like, oh, I definitely want that. So it's interesting how much competition now is coming up between cancer centers, and how my sleeve is getting pulled on to help cancer centers stand out when it comes to.
Well, before you go on, just to reinforce that, patients talk out there as well. So word of mouth is a big factor when it comes to competition.
Yeah.
And other social media sites are, oh boy, I really had great care at XYZ place and whatever. So yeah, but we don't want to forget the consumers of this, the patients. They talk
And they all know each other. And if somebody gets something that somebody else doesn't get, they know that too.
That's right.